Before surgery, the exact area of your breast which needs to be removed may require pinpointing. This is called localization and will take place at the Mermaid Centre on the same day as or the evening before your surgery. You will receive local anaesthetic for this procedure and a radiographer will be with you all the time. Here in Cornwall, oncoplastic breast surgery is carried out at both St Michael's Hospital and at Treliske. Both are dedicated to providing the highest possible care for the women they treat. If you have your surgery at St Michael's, you will stay here on St Michael's ward, a bright, clean, peaceful, female-only ward. It has a dedicated and highly specialised nursing team who are skilled in caring for the specific needs of women undergoing breast surgery.
Hello, we're the girls from St Michael's ward.
St Michael's ward staff strive to give our patients the best nursing, medical, emotional, psychological and spiritual care to meet the needs of the individual. Our reward is in improving the physical and or emotional state of those in our care. In order to achieve this, we will provide an atmosphere of safety and love by using our skills and knowledge within the boundaries of our resources. Hello, I'm Maria Rojas. I'm one of the staff nurses at St Michael's. I'm also the breast care link nurse, which means that I participate in a lot of the aftercare for the breast patients. It is based on 4 beds in each bay, and we have a capacity of, at the moment, 18 patients. We aim to give patients privacy and dignity at all times, so giving a patients 4 beds in a bay allows us to do that. We have a very good multidisciplinary team that will be here to guide you through every step of your procedure and aim to make your stay here as comfortable and as easy as possible. We also here give individual care to patients, aiming to give a little bit of emotional support to the patients and to their relatives at all times. My role as the link nurse is very important in the fact that I sit down and talk to patients when they come in, guide them through what may happen, although they have seen all the breast care team prior to coming in. We are trying to be very flexible with visiting because we feel that patients need as much emotional support from the staff and from the patients. So we do allow patients' relatives to come in on different times to visiting times.
When you are ready, you will be taken from the ward down to theatres for your operation. Here at St Michael's, you will be accompanied by either Shaky or Dave, who will ensure that you have a comfortable journey.
Hey, where you going?
I'm Dave.
I'm Shaky. We're the porters that bring you to theatre and keep you entertained.
As a breast care nursing team, we endeavour to phone every person after their surgery, normally somewhere around 5 days, to see how they're getting on. Oh, hello, is that Maureen there? Hi, it's Jane Gray, one of the breast care nurses. Yes, no, I'm just ringing post-operatively, as I said I would, to see how you're getting on. We'll be asking you about how much pain you've got or whether your pain is well controlled, and if advice is needed there, then to give the advice. Looking at how the exercises are going, if you've been given exercises, and just an opportunity on the telephone to discuss if there are any particular questions, anxiety or emotional difficulties that you're wanting to have some input in. We would also be answering questions if you had any about your dressings, whether they needed changing, when you go, if you need to see your doctor or a district nurse, and when indeed you're coming back for your follow-up appointment. You might ask us things about further treatments, and certainly at this stage we might not have all the answers, but we should be able to point you in the right direction and then confirm things when you come to your follow-up appointment. And then what we can do is we can either see you a little earlier or we can answer your questions on the phone, but we'll certainly see you next week. Yes, I think it's 2:30. Yeah, no, if that's all right. Okay then, that's lovely. Brilliant, look forward to seeing you again. Take care then, bye-bye.
2 weeks on after your surgery, you will come back to the Mermaid Centre for another appointment with your consultant, who will check how your wound is healing and discuss future treatment plans if this is required.
When it came time for my operation at St Michael's, I was a little bit apprehensive, as you can imagine. I was worried about the anaesthetic and its effects, but in the end there was nothing to worry about. I wasn't feeling sick afterwards. The operation itself went off really well. It was a long operation because I had my reconstruction at the same time as my mastectomy. But at the end of it, I woke up and I had a pair of boobs, and I was happy. And that was the first thing I looked at when I woke up. And it's all been uphill from there. I think once I'd had the operation, I knew the cancer was gone. That was the beginning of my journey, and I was on the road to recovery. And they looked after me beautifully at the St Michael's. The nurses were wonderful, and it was a much better experience than I could ever imagine it was going to be.